Good evening, David. Thank you so much for all of your help tonight. And first and foremost, I want to say welcome and thank you, over 1,000 strong, joining us for our Sonoma County telephone town hall focused on California's coronavirus response. My name is Mike McGuire, and I'm honored to be able to work with you here in Sonoma County. The most important part of tonight is going to be hearing from you. We're going to spend as much time possible answering your questions and your comments in real time. We encourage you right now to send in your emails, senator.mcguire@senate.ca.gov. Again, email your questions in real time, senator.mcguire@senate.ca.gov. I got to tell you, we have an outstanding panel joining us tonight. Before we get into this evening's town hall, I would like to take a few moments to be able to provide some brief opening remarks. And I think we all deserve some good news, so let's start with that good news, and it's because of the early, decisive action taken by Bay Area counties and public health officers like Dr. Mays right here in Sonoma County. Because of their early actions, literally thousands of lives have been saved in Sonoma County and throughout our region with the shelter-at-home orders. We are seeing consistent positive trends as well, and I'd like to focus on two of those trends this evening. First and foremost, patient numbers. Patient numbers at local hospitals remain at or below average. This trend has been consistent for the last several weeks, and this is why the state announced today that postponed surgeries can once again begin at Northern California hospitals. The second trend I'd like to focus on are virus numbers. Virus numbers are continuing to grow, but the rate of the spread has slowed significantly, especially here in Northern California. And let's be honest, this is because of your sacrifice and your hard work. Our progress to open our communities safely and strategically does depend on four key principles: continued stabilization of cases, daily death rate, hospitalizations, and ICU admittance. Now, we're going to hear from Dr. Mays, the public health officer from Sonoma County, in just a few moments, specifically focused on shelter-at-home orders. Stay tuned. Finally, what's happening tonight would be unthinkable just a few short weeks ago. So many are struggling to be able to pay their bills, and so many are struggling to put food on their table. That said, here's what we know about Sonoma County. Sonoma County has faced down some of the most catastrophic disasters in American history, and we have always persevered. And I have no doubt we're going to do this again. We're going to be able to beat back this virus. And please know we're going to be here with you every step of the way. I would now like to be able to transition and go over the flow for this evening's town hall and introduce our all-star speakers. First and foremost, we're going to hear from Dr. Timothy Brewer. Dr. Brewer is an infectious disease physician at the UCLA School of Medicine. He's going to be giving us an overview of the coronavirus, what we know, where we're going. He's going to be focused on the antibody test as well as masks. I'm going to turn it over to the public health officer, Dr. Mays from Sonoma County. She'll be focused on the confirmed number of cases in the county, provide us a testing update. She'll be looking at when we expect to hit the peak, or if we've actually hit that peak here in Sonoma County, and what will opening up the community look like, and what is that potential timeline? Again, that's based off of those four principles. More to come. We're then going to hear from our hardworking Superintendent of Schools from Sonoma County, Dr. Steve Harrington. He's going to give us an update on distance learning, graduations. We're getting a lot of questions tonight from parents. Will graduations happen? He's going to focus in on that. And we're also hearing a lot from parents about school next year and what should their students be prepared for in the fall. He'll be focusing on that this evening. And finally, we're going to get an economic forecast from the leading economist from Sonoma State University. He's going to be giving us an overview of the Sonoma County economy, how long Dr. Eiler thinks that this recession is going to last, and how should businesses be prepared for a soft opening. Without further ado, though, ladies and gentlemen, we're now going to go to our first panelist. And we're going to turn it over to Dr. Brewer from UCLA Medicine to give a 3 to 4 minute update on the coronavirus across the state. I'll give you a 30-second prompt, Dr. Brewer. And I got to say, Dr. Brewer, you've been with us since the very beginning. We're grateful that you're back. The floor is yours, sir.
Thank you very much, Senator, and I'm delighted to be able to be back again to talk with everyone. First, let me reiterate my thank you as well as someone who is working in hospitals and taking care of COVID patients. Your incredible hard work and sacrifice has made a huge difference, and California has not seen the surge in hospitalizations and deaths that some of our sister states have, and I very much appreciate your help in saving lives across California. Right now, we have about 33,000 cases in California, about 1,200 deaths. That's a mortality rate of about 3.8%. So again, we're both below the national average, which is running about 5.6%, as well as the global average, which is about 6.8%. Globally, there are about 2.4 million cases and about 170,000 deaths. You've probably heard that coronavirus, COVID-19, primarily affects older individuals. I want to dissuade you of that. 48% of the cases in California have occurred in individuals between the ages of 18 and 49. And so while people over the age of 65 or people with comorbid diseases like heart disease, high blood pressure, obesity, or hypertension are more likely to be hospitalized or to die from COVID-19, anybody can get this disease, and that's why it's so important that we all work together to protect each other as well as our vulnerable populations. Another thing you may have heard is that African Americans are disproportionately affected, and that's certainly true on a national average. About 34% of cases across the U.S. have occurred in African Americans or Black Americans. They represent about 13% of the population. Here in California, that's less so. So among our African American population, they account for about 7% of the cases, and they make up 6% of the population, but they do have excess mortality. So about 12% of the deaths have occurred in African Americans, and that's something we can talk about in the question and answer period. I also briefly just want to mention about antibody tests. You may have heard about the recent Stanford study that suggests that somewhere between 2.5 and 4% of people in Santa Clara County may have been infected with COVID. Antibody tests are tests of the immune system to the presence of a virus. We do not use them to diagnose active disease. So if you have symptoms and you go to the hospital, we would not use an antibody test. And right now, they're primarily used for research and public health purposes. So trying to get a sense of how much virus has occurred in the population, similar to what that Stanford study was doing. I want to briefly also just remind you about masks. Masks are not a substitute for social distancing. Social distancing, trying to prevent the spread of virus from people who are infected to people who could catch it, remains critically important. What the masks do is they help to block those respiratory droplets. So if you're infected and you don't know it, when you're talking and you're speaking, those secretions get caught in the mask and hopefully do not spread virus to anybody else. Finally, let me just briefly mention about pets. Cats can catch coronavirus, and there are data to show that in the laboratory, a cat can spread coronavirus to another cat. That doesn't mean they could necessarily spread it to a person, but if your cat is sheltering in place and staying at home like you are, there's no way for the cat to catch coronavirus unless a person brings coronavirus into the house. So please keep your cat in the house and it will stay safe. Dogs do not seem to be as susceptible to coronavirus as cats. And I'll stop there and look forward to answering the questions.
Thank you so much, Dr. Brewer. Dr. Brewer brings the issue of cats up because we've been receiving a lot of questions tonight now that it has been confirmed back east that 2 cats now have positive tests for coronavirus. More to come on all of those issues in just a moment. We first like to turn it over, though, to the Public Health Officer for the County of Sonoma, Dr. Mays. Dr. Mays, we want to thank you for your fantastic work along with the Board of Supervisors. You have 3 to 4 minutes. The floor is yours, and I'll give you a 30-second prompt.
Great. Thank you very much. I'm going to start off by giving us an update on the confirmed number of cases in our county. So as of yesterday, we had added 10 new cases to reach 192. And today, hot off the press, we have 2 more cases. So we're at 194 cases, of which the majority have recovered. That would be 87, and we have 105 active cases. And as we reported before, we had 2 deaths. Now, of these cases, the majority are happening in our central counties. So that's to be expected because it's an urban area, and there's probably a lot more people that are in the community in the urban setting. We also have about half and half male and female cases, and something I really want to focus on is that in the recent past couple weeks, we've been doing really intensive contact tracing and testing all contacts to active cases, whether they're symptomatic or not symptomatic. So the majority of our cases now, over 50%, are occurring in contacts. We're seeing very few cases occurring in the community transmission cases that have no reason necessarily to be infected. They weren't in contact with anybody, and we don't know where it came from. So that's really good news. That means that everybody here in Sonoma County is doing their job and staying at home and sheltering in place. And I'd like to thank everybody for those efforts, because from our modeling, we know that we're way ahead of the game because we're not seeing the numbers of cases that we suspected we would see. And I believe that's because the shelter in place has been so effective in cutting down on community transmission. And I, again, want to thank everybody for wearing the facial coverings when you're going out for your essential activities and businesses. Now, I'd like to give you an update on testing. We have really ramped up our testing. We've been able to get a lot more swabs and test kits, and we're going to begin much more widespread community testing. Starting this Saturday, we're actually going to start with our first priority group, which are healthcare workers, both symptomatic and asymptomatic healthcare workers. We are going to see them by appointment in a drive-through testing Saturday and Sunday, and as long as it takes, really, to cover all of our healthcare workers. The information will be put out soon on social media and through a press release. After the healthcare workers, we're going to test widely amongst our symptomatic first responders group, our symptomatic people over age 65, followed by our symptomatic persons who work in infrastructure areas like utilities and courts. And then lastly, I'm hoping very soon we're able to provide testing for people, all symptomatic people in our community. So that's what we're doing, and we'll give you more news about that. We do see from our modeling efforts that the peak is going to be hitting Sonoma County later than expected, really due to shelter in place. And so we'll keep you posted on the latest modeling data as we get it. And lastly, we are talking about what's a good way for us to align with the governor's executive order, which has no end date, as many of you know. And we're looking at different areas where we might be able to loosen some of our restrictions here and there a bit. And the parks are the first place that we're looking at. So I think I'm going to leave it at that and turn it back to Senator McGuire. Thank you.
Thank you so much, Dr. Mays. We'll get more on the issue of opening up and the peak in just a few moments. And again, Dr. Mays, we appreciate you being on. We're now going to get an update on Sonoma County Schools from Steve Harrington, the Superintendent of Sonoma County Schools. Sir, you have 3 to 4 minutes. We're grateful that you've joined us tonight. I'll give you a 30-second prompt. The floor is yours, Mr. Superintendent.
Thank you. First of all, let me talk about distance learning. It's something that was developed and immediately acted on without much pre-warning or information. most of the districts, about 80% of the schools, 85% of the county is covered with connectivity. We have some remote pockets in Sonoma Valley, and we have remote pockets on the North Coast. So we are using what we call blended learning there, which are packets and some interface activities with television. I wanted to talk also about the meal distribution program for families and students. To date, we have served over 140,000 lunches in Sonoma County in 22 sites. And the site location can be secured by going to the Sonoma County Office of Education website as well as the Office of Emergency Services website. We are providing child care facilities for essential workers, and that is handled also through the Office of Emergency Services in the county office. The other thing I keep getting questions about is school and graduation for May. Today, the county superintendents, there are 40 counties, school districts, so we met today and we talked about the months of May and June. The reality is, with the peak yet to hit Sonoma County, and we will have social distancing still in place, the likelihood of graduation ceremonies, traditional graduation ceremonies, will not be probably scheduled for most districts. It's a sad situation for our seniors, and that also means the loss of proms. The other situation as it relates to May and June is for those students who are in special education classes that receive what is called extended year. And extended school year is basically 20 additional days for support for students in special needs classes. That will be offered, but it will be offered through an extended learning format in all the schools in Sonoma County. And I encourage parents with special needs children to check how their district calendar will conform to that. In the fall planning, when will school open and what would it look like? We're going to work with Dr. Mays on that. First of all, it all depends on the case studies as it relates to Sonoma County, and it will relate to what social distancing standards are in place. Will it be a traditional school opening? Well, if all the governor's key readiness points are in place, yes, but I don't think they will all be in place by the time August rolls around. So the district superintendents, we've been working on a post-pandemic plan, which has a multiple set of options. Many of our small and rural schools can possibly accommodate Dr. Mace's social distancing standards, but our suburban urban schools will have a larger time and difficulty dealing with that. So we're looking at alternative formats. Some of that could include an AM/PM schedule. Some of that could include an alternating day schedule. So there's a variety of things there to look at. And I think the other thing to just keep in mind is we're working on this as fast as we can. We have dealing with the situation as it occurs, and situations are changing rapidly. But I just want you to know the public schools are there. We are also putting on the websites some parenting and relief for parenting on dealing with child difficulties and issues. The counselors are all working in all the school settings, plus the Sonoma County Office of Education intervention counselors are available as well. So please check your school's website for support in those areas. And that's where we are with schools right now, Meg.
Thank you so much, Superintendent Harrington. More to come from the superintendent in just a few moments. We're getting quite a few questions in. If you'd like to be able to get your questions or comments answered tonight, senator.mcguire@senate.ca.gov. Before we get into questions and answers, we'd like to be able to take a look at an economic forecast for Sonoma County. We're bringing in the best economist here in the North Bay, and that's Dr. Either from Sonoma State University. The floor is yours, sir. You have 3 to 4 minutes, and we'll give you a 30-second prompt. Dr. Either.
Thank you. So for the Sonoma County economy, we're watching the California national economy as well, as those tend to have data that come out that tell us where we might be going. Some unemployment data have come out, and especially new unemployment insurance claims have started to come out about Sonoma County from March. And we saw a 15-fold increase from the previous month of people that have gone and wanted to start unemployment insurance. So we know that more unemployment is coming. So from an economic forecast standpoint, the pain in the data and the pain really is going to be in April and May to get started. And then what's going to happen after that is if we start to open the economy sometime in May in a slow rolling fashion, perhaps in early June, the test is going to be what businesses open first. Right now, we're still not sure about that to date, but we will find that out hopefully relatively soon. And whether or not those job openings allow the economy to function at the correct level to where we can minimize the number of job losses and the number of business losses. The number of business losses is the critical factor here in what I call the depth and the duration of the episode. The depth is going to be initially defined by job losses, which we think are going to end up with Sonoma County is probably going to start peaking around 17 or 18% unemployment. We're seeing that in the unemployment insurance claim numbers, and we think it's going to get that high and maybe slightly higher for 1 or 2 months. Then, if the economy begins to come back well, we should see some turn and some workers come back. If businesses are lost on top of the job losses, that's when the so-called capacity of the economy shrinks, and that's when the duration gets longer and the depth may actually be a little deeper. So what we're trying to do is as policymakers, for example, is trying to put policies together. That's why interest rates have been pushed low, and this is why the PPP plan through SBA and why the unemployment insurance expansion in terms of the duration of it and also the amount you're getting at home and also the checks that are arriving at home from Congress. All that is meant to provide you with more confidence and also with an ability to sort of consume per normal once the economy gets back together. In terms of the rollout and thinking about the ultimate damage to the economy, a good analogy is to think about Hurricane Katrina to the New Orleans area, but generalized across the country and in some cases across the world. And we, as Senator McGuire said right off the top, we have a long history, unfortunately, here with disasters in terms of their depth and breadth. So having it multiple years in a row has really, I think, given us a lot of tools at the Board of Supervisors level, at the state senator's office to really deal with these things and deal with what's going to happen at all wage levels and for all people throughout Sonoma County. So we're expecting no real turnaround until at least 2021, and it's going to be kind of a slow slog for the rest of the year. But if we can get the economy going sometime in June and sort of get back to more normality, then at least we're going to capture some of the tourism season, which is a big thing for Sonoma County, and maybe not have as long an episode. But think 2021 right now once we start to open up, assuming that happens in early summer.
Dr. Either, thank you so much. We have several questions about the federal stimulus coming up for Dr. Either in just a few moments. We're now going to get to the most important part of this evening, and that's your questions, your comments. We're getting literally hundreds of questions into senator.mcguire at senate.ca.gov. We do want to hear from you. Let's get right into it. Our presenters will give 30 to 60-second answers to your questions to ensure we get to as many as possible. This first question is for Dr. Brewer from UCLA Medicine. It comes to us from Mitch in Healdsburg. Here's what Mitch has to say. I suspect the coronavirus has run through our business as one of our employees' wife had traveled to Wuhan in January or February and returned with the virus. I and a few others came down with what we thought was a bad flu in late February. At least 2 of our employees went to the doctors and were tested. They tested positive for influenza type A. Is it possible that that was a false positive for influenza, and in fact, it was the coronavirus? Dr. Brewer, the floor is yours.
Thank you, Mitch, for your question. No, in February, we were still in the midst of our influenza season, so that's probably a true positive. And in fact, it was a very difficult influenza year with about 60,000 deaths across the country from influenza. The coronavirus should not cross-react with an influenza virus test.
Thank you so much, Dr. Brewer. This next question is going to go to the Superintendent of Schools. Mr. Superintendent, this is coming in from Regal in Larkfield. Are you really considering separating the school days with A and B in the morning and afternoon? Mr. Superintendent.
Well, that's not my individual choices. That's going to be decided by district. So her residence district will make the decision depending on the size of the student and school population. That was just one model or an example that was given, but we are looking at multiple models and examples.
And would you think it's fair to say, Dr. Harrington, Superintendent of Schools, that may happen, but you have to play this out a bit longer to see where those numbers are at with the virus?
Correct. As I said, we'll be waiting for Dr. Mays, who will give us the social distancing standards. If it's 1 to 200, that will give us more flexibility. If it's 1 to 50, that's going to limit the flexibility and what the program will be. but each district will have to decide. It could even be that a district will just continue with distance learning until such time that they have greater flexibility to open their school campuses.
Thank you so much. This next question is going to be for Dr. Mays. Dr. Mays, this is coming in from Jim. Jim says that he's a camp director in Sonoma County, and he's wondering what the status of camps are for this summer. Dr. Mays, the floor is yours.
Yeah, hi. Thank you for the question. So we are looking at ways in which people can get outdoors and perform some activities. We've already clearly said people can go out walking, biking close to their homes. So we are looking at parks and other outdoor activities. So I think you'll be hearing more on your question soon.
Dr. Mays, would it be appropriate to say there's a possibility that summer camp, if it happens, will be different? There will be a new normal for those kids that may go to summer camp if it's allowed?
Well, yeah. I mean, everything I think is going to be a bit of a new normal for us because the basic principles of social distancing, or we should say physical distancing, because we really mean, staying 6 feet away from other people, not clearly emotional distancing, and the new norm of wearing facial coverings, which is now a health officer order if you're in facilities or in closed spaces or where you can't social distance. These things have probably changed what we used to consider as normal.
Thank you so much. We're going to stick with Dr. Mays, the public health officer from Sonoma County. Dr. Mays, we're getting a lot of questions about golf courses. When will golf courses open? Am I allowed to walk on a golf cart path with my husband? This is coming in as well, if a golf course is closed. If you don't mind, take that first general question about golf courses and then to the golf path.
Right, so we're considering all these different questions. I'm working very closely with our Parks Director, Bert Whitaker, as well as others here in the Public Health Department, our stakeholders, and all of these issues are exactly at the top of our list for discussion. So we'll let you know more as we make the decisions.
Would it be an accurate statement to say that parks would most likely be first to see a loosened shelter-at-home order, and then you'd consider business? Would that be a fair statement?
Yeah, I think the parks are actually an area that we're really looking at because, first of all, they're outdoors, and outdoor activity is definitely going to be safer for individuals than an indoor activity. And I think it would really be a relief for a lot of our residents to be able to visit the park. We're looking at the mental health benefits, the physical activity benefits. It's all weighing benefits versus risks. And I think when we have the other mitigating measures in place, like social distancing and the facial coverings, then I do think that that's an area that we're looking at.
Thank you so much. This next question is going to go to Dr. Brewer. Dr. Brewer, you mentioned cats. Sharon wants to know about her 2 dogs. Sharon is concerned about taking her 2 dogs for a walk in the neighborhoods. In her neighborhood. She says that dogs sniff everything, and I'm concerned that they might get the virus on their fur and bring it back to the house. Can you answer that, Dr. Brewer?
So, Sharon, I too have a dog who sniffs everything, and at least in the laboratory, it's very difficult to give a dog COVID-19 infection. They don't seem to be as susceptible as cats. Viruses do not survive a long time on surfaces, so if someone coughed or sneezed on your dog, the virus would die rather quickly. It's good just because dog fur can have other bacteria to wash your hands after petting your dog, and you should be fine.
Thank you so much, Dr. Brewer. We're going to stick with you. When Nona has emailed in, she is asking about her groceries that she purchases. Should she disinfect her groceries before she puts them into the refrigerator? Dr. Brewer.
So another terrific question. The short answer is no. Viruses do not survive a long time, as I mentioned, on surfaces. So if you put them in the refrigerator and leave them for a day or two, any viruses that were there should have died and you'll be fine. But what you should do is after you come home and unpack your groceries, wash your hands. So that would be a reasonable thing to do with soap and water. After handling groceries, make sure to wash your fruits and vegetables too.
Thank you so much, Dr. Brewer, UCLA Medicine. Our next question is going to be going to the Sonoma County Superintendent of Schools, Dr. Harrington. Dr. Harrington, this is coming in from Gloria in Santa Rosa. How are colleges handling SAT scores since my kid wasn't able to take the SAT? Dr. Harrington.
The California State University System, the California Private College League, and the University of California have all will be waiving the test score this year for California residents applying for schools in California that are in those associations. So she should be fine with that, and I would encourage her to apply in multiple places.
Thank you so much, Dr. Harrington. This next question is going to be for Dr. Mays. Dr. Mays, this is coming in from Lee. Lee asks, when can African Americans who are said to have experienced the greatest coronavirus death toll to date expect to get tested upon request? Dr. Mays, the Public Health Officer, Sonoma County.
Well, we are expanding testing to different priority groups. Again, as I said, we're starting with healthcare workers, first responders, but in that list, and hopefully very soon, we will be offering the test to anyone in the community that is symptomatic, and shortly thereafter, we may also extend the test to those people who are concerned who are asymptomatic. There is also the serologic test, the blood test that we've been discussing, which looks to see who has been infected. So at some point, as soon as we get this test, which we've ordered, I'd like to test a representative sampling of our community to get at these questions, exactly who have been infected in our community. I think that would help us know better what's happening with coronavirus in our community.
Dr. Mays, so at the current time, due to the lack of tests, and by the way, this is a national challenge, can you one more time go over how you are prioritizing patients who would receive tests or individuals who receive tests in the county? Can you cover that quickly here for the town hall?
Sure. As I said, we actually have a lot more test capability now than we did last month. So not only do we have more test kits and swabs, we also have a lot more staff that we pulled into public health to test people, and we have numerous labs that are running the tests. All of our hospital labs are running their own tests. That's Kaiser, Memorial, and Sutter, and our public health lab is running 120 tests a day, and now UCSF Medical Center has offered to do testing for us too. So now we are prioritizing contacts to cases because those are the persons who are very high at risk for having COVID. We're also prioritizing our healthcare workers and our first responders because they're the ones who are coming into contact with patients who very well may have COVID as well. We're then prioritizing people who are really susceptible to bad outcomes with COVID, like those over age 65 and people with underlying medical conditions. After that, we are also looking at congregate settings, the people who are coming in and out of nursing homes or residents of nursing homes, healthcare workers in those settings as well. But residents of congregate living facilities, I just want to let people know we've done a lot of surveillance testing already in these areas, and so far haven't really found any situations like some of the other counties in California are facing. And then, of course, all symptomatic individuals in the community also are going to be our priority.
Thank you so much, Dr. Mays. And Dr. Mays is very popular tonight. Dr. Mays, we're going to have you answer one more, then we're going to go to Dr. Brewer. Dr. Mays, what is the likelihood that the May shelter-at-home order will be extended?
Well, first of all, I want to say that we already are under the umbrella of the governor's executive order at the state level, and our order is extremely similar to the governor's order. The governor's order has no end date. So in that context, in order to be, very specific for our county's needs, our shelter-in-place order addresses a few additional things other than what the governor's order covers. And so right now, we're good to go until May 3rd, and we are having discussions as to where next to go with the next rendition of that order, if that is to occur. But again, the governor's order is in place, and we are aligning with that and has no end date at this time.
Thank you so much, Dr. Mays. We're now going to go to Dr. Brewer. This one is coming in from Susie. Susie is 72 years old, and she's asthmatic. She had recently read that asthmatics are at higher risk, but then today she read asthmatics aren't among the sickest patients. It's those who have cardiovascular disease are at greater risk for the coronavirus. Can you please give us the truth? Dr. Brewer, if you can answer Susie's question.
So, Susie, cardiovascular disease is more common in the United States than lung disease and asthma, so that's why we're seeing more of it with COVID-19. But individuals with lung disease like asthma are also at increased risk, as are individuals over the age of 65. So really wonderful that you stay at home, and if you can, try to get someone else to go out and get your groceries and do any errands that you need to have done.
Thank you so much, Dr. Brewer. We're now going to be turning it over to the lead economist from Sonoma State University. That's Robert Eiler. This is coming in from Gavin in Windsor. He has several questions about the V recovery. It's a very long question, Dr. Eiler, but I'd like to be able to hone it in 3 points. Explain what a V recovery is, how does it work, and do you think a V economic recovery is going to happen in Sonoma County in the North Bay? Dr. Eiler.
Understood. So a V recovery is when you basically bounce down and bounce back up. So think about taking a tennis ball and throwing it as hard as you can at the ground directly below you, and it bounces almost right up and hits you in the face. A V recovery looks like a V on a graph. So are we going to have a V-shaped recovery, meaning that, let's say, by the third quarter of 2020, this is going to be starting to be a faded memory? It's unlikely. The amount of unemployment we're expecting to see and the potential business losses that have already happened and or that we're going to see are all going to contribute to something that's probably going to be relatively deep in the front end and maybe linger into 2021. So that's a V-shaped recovery really depends on our ability to respond very quickly and rebound very quickly, and this does not look like it's going to happen that quickly. We could have a modified V where the right-hand leg is a little extended in terms of moving from an acute angle toward an obtuse one, but we should be thinking 2021 just to be safe.
Thank you so much, Robert Eiler, Chief Economist there at Sonoma State University. Dr. Mays, we're coming back to you, and we're going to talk weddings. This is coming in for Christina. Christina says, my family has a wedding coming up on August 1st. I'm assuming that we're going to have to reduce our guest list. When do you believe the community gatherings of up to 50 people will be able to take place? I know you're looking into your crystal ball right now, Dr. Mays, but talk about these summer weddings. There's a lot of weddings in Sonoma County. July, August, September, October. What does your gut say about the number of people, or will weddings actually happen in Sonoma County?
Yes, hello. That is a very good question, and it is sort of a crystal ball question. I just want to let you know that we're following the data. We're really trying to track what we expect. We have new modeling data that will be coming out that hopefully is more closely going to estimate what we'll see over time with our shelter in place and with relaxing shelter in place slowly over time. So it's hard to predict out to August what's exactly going to be happening, but I believe that at least in the near future, we will continue shelter in place and limit mass gatherings. Right now, we pretty much have a moratorium on gatherings, period, and so we're working to see how that might be modified over time. I know it's not an answer that's specific or answers your question, but it's because we don't have a crystal ball. Thank you.
Dr. Mays, thank you so much. We're going to go to Dr. Brewer from UCLA Medicine. This is coming in from Jeff. Jeff wants to know, and Dr. Brewer, you are probably going to have to give us more of a general response in this, how many people have contracted the coronavirus from outdoor activities versus how many have contracted the coronavirus while, for example, he says, shopping at grocery stores? What's the main cause of spread for the coronavirus? Dr. Brewer, UCLA Medicine.
So, Jeff, studies from China suggest that the main cause of coronavirus comes from prolonged close contact indoors. So think of people living in the same house or working in the same environment for extended periods of time. And as Dr. Mays mentioned, One of the things they're seeing spread among contacts, but less community spread. So we believe that being within 3 to 6 feet of someone for an extended period of time, meaning more than an hour and so, increases your risk of infection, less likely to happen outside or in general public settings where people are moving around.
Dr. Brewer, thank you so much. We are now going to go back to Dr. Mays. Dr. Mays, this is coming in from Elizabeth. Elizabeth is a West Sonoma County resident. She is asking, why does West County have so many more cases than the rest of Sonoma County? What say you, Dr. Mays?
Well, right now, it's the Central County that's reporting the most cases. And as I said, it really has to do more with being in the urban centers, the cities. The cities are going to see more cases than our other more rural areas simply because there are more people who are there all together at one time. I mean, I think that is the best way to look at this. The more community traffic and people out and about that we have, the more congregate facilities, the more places where people are together, that's where we're going to see the cases.
Dr. Mays, thank you. We have 2 questions going to the chief economist from Sonoma State, Dr. Eiler. Dr. Eiler, you've heard a lot of frustration, folks not being able to access federal funds. They're oversubscribed in regards to the payment protection program. Jim is asking, do you believe the new money coming in from the federal government will trickle down to Sonoma County for the Payment Protection Act? Dr. Eiler, you want to explain the act as well? And we'll give you a little bit of time for that.
Sure. In simple terms, the PPP lending is meant to provide a loan to a business to keep their employment base intact, to not let anybody go from a certain point in time, which is February 15th. Lenders are looking at it in a bunch of different ways. So if you take the loan, be sure to talk to your lender about payback, it turning into a grant, and there's a lot of discussion about it turning into a grant by June 30 if you conform to all the stipulations of the loan. But make sure your lender understands what data you provided and how you intend to show that data when the time comes to convert it into a grant. But the idea is really to keep you from making a quick decision to start letting people go and giving you the financial ability to do that with the idea that it ultimately is going to be like a gigantic tax refund. So if that happens, that will help. But that's the basic idea behind it. And if that does work, what the trickle-down aspect will be, you'll actually see that money keep unemployment somewhat in check after this first round of potential job changes and hopefully provide people with an income because the employer will, in a sense, pass it on through payroll and protect the payroll, which is the idea behind it. And that'll keep consumption going on the other side and potentially keep businesses open. And like I said earlier, that's the critical aspect of it. If business loss becomes a lower level demand that becomes and more job loss, those two things combined make the duration of this episode longer. So we should see some trickle down from it. We need to get the economy open to feel the full fruit of that.
Thank you so much. Dr. Eiler, 15-second answer on this one. Do you think with the new federal money for the Payment Protection Program, is it going to hit Sonoma County? 15 seconds, sir.
Yes, it's already hit Sonoma County. So assume it's here already.
Thank you so much. Second question coming in from Eric, going to Dr. Eiler. What kind of local community-based changes are we going to see in our economy with the coronavirus?
Well, under the assumption that we're going to have some restrictions on gathering per normal or how we gather and how we dine out and how we go to concerts and how we go places otherwise, you're going to see a lot of our tourism industry probably have to make some adjustments and have some additional costs on the other side of this, which could change the way that we all interact in wineries, restaurants, et cetera, going forward. So what we're watching very closely to see what social policies come forward in those gathering places in the final fruition and what cost that means for business. So economic development has a serious challenge coming up, and our communities have a serious challenge in terms of the amount of people that work in those areas and in those industries and what, in fact, their future is going to be.
Thank you so much. That's Robert Eiler, Chief Economist, Sonoma State University. We're now going to go to Dr. Brewer. Dr. Brewer from UCLA Medicine. We are still over 1,000 strong with the telephone town hall. Thank you. Questions? Senator.McGuire@senate.ca.gov. We want to hear from you. We're going to ask our presenters to be able to keep those answers a bit brief, as we are getting literally hundreds of questions tonight. Let's go to Dr. Brewer. Dr. Brewer, this one is coming in from Thomas. Thomas says that 48% of cases are found in younger individuals. Can you please speak to the death rate for those individuals?
Sure. So, Thomas, you're right. Roughly half the cases in California occur in individuals between the ages of 18 and 49. About 2% are in individuals under 17. But it's very unusual for people to die in those age groups. So, for example, the mortality rate of confirmed cases in the U.S. is about 30 times higher in individuals over the age of 65 than in individuals under the age of 49. So even though anyone can get this infection, the most serious diseases, hospitalizations, and particularly deaths tend to occur in older individuals, particularly those with other diseases such as heart, lung disease, or diabetes.
Thank you so much, Dr. Brewer. We're hanging with you for a moment. This one is coming in from Lori. Lori is asking, do you really believe that we are going to see a fall boomerang with the virus?
I think, unfortunately, we are going to be dealing with this virus for a while. And if you look at the last pandemic, which we had, which was 2009, an H1N1 influenza pandemic, that virus took about a year to roll across the country and continued to spread before it settled down to be more like a seasonal virus. So I think, unfortunately, we will be grappling with this virus for a while.
So let's stick with you, Dr. Brewer. So you say this virus is going to be hanging for a while across the planet. So talk about the vaccine. When can we expect to see the vaccine? And once one is approved, how long will it take to get rolled out into the communities in America?
So I think it's unlikely that we'll see a vaccine much before a year from now, but there are some people that are more optimistic than I. The National Institutes of Health actually had been working on a coronavirus vaccine for the original SARS virus, not COVID-19, but that gave them a basis on which to start to develop a COVID-19 vaccine, so it may be a little quicker. I think once we have a vaccine that we know works, the production probably will go fairly quickly.
Thank you so much, Dr. Brewer. We're now going to be going to Dr. Mays. She is the Sonoma County Public Health Officer. Dr. Mays, this question coming in from Noel. Noel wants to know, how are you going to monitor overcrowding of parks and beaches when and if they are open in the next couple of weeks? Mm-hmm.
Yeah, so that's a really good question. First of all, we are looking at sort of more of a soft opening. So we'll be very specific in letting people know what the details of that are, but it is definitely in our plans, and it'll be very important to get the message out to the public that as we move towards this, it's important for people not to crowd the parks, to ensure that social distancing can be kept, that ensure that, you do wear your facial coverings when you go to the park, that sort of thing. So in preparation for a soft opening, I really would ask people to comply with whatever rules and regulations we put out in terms of the soft opening.
We have, thank you so much, Dr. Mays. We have the Superintendent of Schools, Dr. Harrington, on the line for the County of Sonoma. This next question is coming in from Arnie. Mr. Superintendent, I know that you covered this in the beginning, but I'm going to have you cover it again. We've had a few questions, and I'm going to read you Arnie's question, and I know you've answered it before, but a lot of folks are continuing to tune in. What will fall look like for my 12th grader in 2021?
Well, a lot of it, as Dr. Mays has said, it will be depending on the distancing standards that are in place in August. If a school chooses to delay its opening, graduation will be pushed out later, and that has an impact on seniors. But basically, it is not going to be a traditional opening of school if we have social distancing standards in place, and we will have to regulate, each district will have to regulate based on the conditioning standards. If it's a 1 to 50 ratio, if it's a 1 to 100 ratio, all those things would have to be accommodated in a school setting. and that becomes a difficult challenge for many districts.
Superintendent Harrington, we're going to be sticking with you. This one is coming in from Maria. Maria has two questions. Will children be moved up to the next grade level this year? Number two, will summer school be taking place? I know that you can't talk about specific districts, but can you talk about in general what you're hearing from superintendents?
At this point in time, if any district chose to do a summer school, it would be through basically distance learning. Most districts are only offering the special ed, federal required special ed summer school, and it will be also distance learning. The first part of that question, Mike, could you repeat what that was again?
Absolutely. Will children be moved up to the next grade level this year?
There's no reason why children won't be promoted to the next grade level. And I'd like to take this time to remind parents to register for kindergarten. You know, so many people are preoccupied with the current situation, but go online to your district and register for kindergarten, because we still there will be a kindergarten class.
Thank you so much, Mr. Superintendent. We're now going to go to Dr. Brewer. Dr. Brewer, this is coming in from John. What is your opinion about the use of the malaria drug for the treatment of infectious coronavirus?
So, John, right now there's still no proven treatments for COVID-19, including the malaria drug. It should only be offered under the supervision of a physician who has expertise in taking care of COVID-19 patients, and we're only considering it for patients who are sick enough to be in the hospital. So we are not using it at all for patients who are not sick enough to be in the hospital, but the take-home message, still no definite proven treatments for COVID-19.
Thank you so much, Dr. Brewer. We're going to go back to Dr. Mays, the Public Health Officer for the County of Sonoma. Dr. Mays, this is coming in from Kelly. Kelly says, Dr. Mays said, quote, the peak is later than expected. Kelly is asking you, can you please expand on that timeline with the models that you're being advised with? When do you expect the peak to hit specifically?
Yeah, so let me just back up and say that the modeling initially didn't think that shelter in place would be as effective as it is, which is why the peak was predicted to be earlier and greater than what we're seeing probably will happen. In other words, we've succeeded in flattening the curve a lot more than what our modelers even expected with shelter in place and other mitigation measures like the face coverings and physical distancing. So it is hard at this time to predict exactly when that peak will occur, but it's going to be later than what we predicted before, which was around June 1st, and we will have more data soon as our modelers take our new data over the past 3 weeks and use it in predicting.
So, Dr. Mays, do you think that peak will hit this summer, or do you think it's going to hit in the fall? You had originally said June. Are you thinking summer or into the fall?
Well, in all likelihood, since the state has predicted that the peak would be a little bit later, but not more than 2 to 3 weeks later, I think we may be on that same sort of trajectory again. It just depends. And as I said, we'll have more data to try to predict this more accurately very soon, and I would like to speak to it accurately as soon as we have the data.
Dr. Mays, we're sticking with you, and we're going to talk about grocery workers. Coming in from another Kelly, will grocery workers be tested due to their level of exposure to the public? Will grocery workers get priority testing? Dr. Mays.
Yeah, they'll be part of the people who are working in essential infrastructure sectors, and so they should be prioritized after healthcare workers, first responders, congregate settings, and our people over age 65 and those with underlying medical conditions. So absolutely, they're on the list for being tested.
Thank you so much. We are now going to go to Dr. Brewer. Look, every week we are getting a lot of questions about pets, and they're serious questions, and we love our pets here in Sonoma County, so I'm going to go back. I'm looking to Carrie right now. We have about a dozen questions still coming in on the issue of coronavirus in cats. So I'm going to have you go back to the original discussion that we had, Dr. Brewer from UCLA Medicine, coming in from Corey. What do the symptoms of coronavirus look like in cats, and what is the mortality rate in felines? Dr. Brewer?
So, Corey, unfortunately, I'm not aware of any data on mortality. So there have been one published study where they gave coronavirus to cats, and then they actually euthanized or killed the cats to see if the cats had gotten infected. So I don't know if the cats would have died otherwise. There was a second study where they showed that a sick cat was able to spread coronavirus to a cat in a cage next to it. But again, that doesn't tell us anything about mortality rates. And then there is a tiger that actually got coronavirus from its keeper. So we know that humans can transmit it at least to tigers, but probably to domestic cats. The thing to remember is if your cat is kept indoors and stays in shelter in place just like you're doing, then the cat can't catch coronavirus. It can only get it if a person with coronavirus comes in. And then if a cat seems to be exhibiting symptoms of being sick, the best thing to do would be to call your vet.
Thank you so much, Dr. Brewer. Dr. Brewer, we're going to stick with you. Then we're going to go to a question from Blue in Grayton on the census. This next question is coming in from Lisa. She is very nervous about going out to her favorite Thai restaurant. She is worried that she can get the coronavirus from eating cooked food. Is that true, Dr. Brewer?
So, Lisa, there is no evidence that you can get coronavirus either from cooked food or raw food. It's not a foodborne disease that we know of. However, I would recommend that you wash your fruits and vegetables when you get home and that you wash your hands. Last week when I was on one of these town halls with the senator, I had mentioned I had gotten takeout. What I hadn't mentioned was I had gotten sushi. So I'm actually still getting raw food takeout as well. But what I do is when I bring my cartons home and after I put my food on a plate, I do wash my hands before I eat. And I think if you do that too, you'll be fine.
Thank you so much, Dr. Brewer. Are you getting takeout tonight?
I'm not sure yet. Haven't planned dinner yet.
Thank you so much, Dr. Brewer. We're going to go to Blue in Grayton. His question is the census still happening? I'll take this one very quickly, and then we're going to go to Dr. Brewer, a question about Santa Clara County. Yes, Blue, the census is still happening. If you can, please fill out your census form online. As we all know, the census, it helps fund police and fire. It helps fund public health, affordable housing. You should have received a postcard or an email from the census department in the federal government. Please take a moment to be able to fill out your census card or go online to census.gov and be counted. Thank you so much to Blue. We're now going to go to Dr. Brewer from UCLA Medicine. This is coming in from Paul. The Stanford report on the antibody levels in Santa Clara reported that the exposure of the population was much higher than previously thought. One of the conclusions, this is according to Paul, was that the virus has had a wide exposure already, and some have felt that this indicates the lockdown is not necessary because the virus is already here. We're going to go to Dr. Brewer to comment on this. Is the shelter-at-home order necessary even though the virus is already here? We'll go to Dr. Brewer, and then we're going to have Dr. Maves, the public health officer, chime in on Paul's comment as well. Dr. Brewer from UCLA Medicine first.
So Paul, there are actually a couple issues there, and let's tease them apart. First, the shelter-at-home order is critically important because, as Dr. Mays said, it's helping us flatten the curve. And in California, our cases, while the rates are slowing down, are still increasing. So we are not out of the woods, and we do not want to take the pressure off the virus and allow community transmission to spread. We want to keep the pressure on the virus, keep that curve flat, keep it from exploding. The second part of your question is, has the virus been here? And the answer is yes, probably longer than we thought. So you've probably seen in the news that there were 2 people who died in Santa Clara County, one on February 6th, one on February 17th, that look like they died of COVID-19. I haven't seen the actual data yet, just the news reports, but that would suggest that the virus has been around longer than we thought. And the second is, yes, there's probably been more spread than we thought, but even the Stanford study is suggesting that the amount of spread is somewhere around 2 to 4% of the population. So there's still a lot of people who could get this virus, and that's why the stay at home is so important to still project the majority of the population.
Thank you so much, Dr. Brewer, UCLA Medicine. We're going to go to the public health officer from Sonoma County, Dr. Mays. Do you want to comment on Paul's question?
Yeah, I mean, I, again, agree that the stay-at-home or shelter-in-place has been incredibly effective in decreasing the number of cases we're seeing all of a sudden. So, in other words, keeping people out of the community has kept this virus from spreading in our community. As I've mentioned, now the majority of people that we're diagnosing with COVID are people who are household contacts to people who have COVID that we've targeted for testing because we want to find out whether they have COVID or not, and they're very highly likely in a high-risk group to have COVID. So the shelter-in-place order has been incredibly effective, and as we loosen the shelter-in-place order, which we really have to do over time, we will see more cases, and we're not out of the woods, and that's why part of the governor's strategy is to know when we need to start looking at putting back more restrictive measures. Now, as far as the virus and how long it's been around, I would agree completely with Dr. Brewer that likely the virus was spreading before we had an inkling that to test for it. So, in all likelihood, it was around earlier than the first cases that have been described. Now, still, the total percentage of the population that's infected is pretty low. It's about 2 to 4% in Santa Clara, meaning it's probably even lower in Sonoma County, especially since we put our shelter-in-place order in effect very early when we only had a handful of cases.
Dr. Mays, thank you so much. We're going to stick with Dr. Mays. We have time for a few more questions. Then we're going to need to start wrapping up, and we are so grateful. We still have over 1,000 folks who are joining us tonight for our Sonoma County Coronavirus Town Hall. Thank you all for hanging with us, sticking with us this evening. We're going to go to Dr. Mays. This one is coming in from Hunt. Hunt says, for the surge to occur in late summer, something is going to happen in the last half of May. What am I missing? That's coming in from Hunt, Dr. Mays, and we'll have Dr. Brewer comment on that as well.
Yeah, so it's really difficult to predict at this point exactly when a surge would occur. Now, again, as long as we have shelter in place, we are not seeing that surge. As you can look at our own numbers, we're adding anywhere from about 2 to 10 cases a day. I don't think that qualifies as a surge. I believe that over time, if there is more community transmission, then it becomes more exponential. In other words, what we're doing is protecting us from the very surge that we're worried about. So over time, as we loosen potentially some of our restrictions, then I think it will be more important at that time that we predict and have more modeling data to predict when that surge would actually occur.
Thank you so much, Dr. Mays. Dr. Brewer, anything that you want to comment on that? And then I'm going to go to one more question for Dr. Brewer. Then we have a question for the superintendent and one last question for Dr. Mays. Dr. Brewer, anything you'd like to comment on about that surge?
So just to say that we don't have as much data, but at least looking at what's happened in Singapore and Korea, they started to see a rebound in cases in about 2 weeks after they started loosening up, similarly in Hong Kong. So I think if we were to cut back on what we were doing, we might see in about 2 to 3 weeks a rise in cases.
Thank you so much, Dr. Brewer. One last question for you. This is coming in from Peter in Healdsburg. He has continued to go to Starbucks throughout the coronavirus. He wants to know if his barista has the coronavirus and touches his coffee cup lid, can he get the virus?
So if she had active disease and got it on her hands or coughed on the lid, yes, it is potential that if you were to drink that coffee right away, that you could get it. Hopefully she is wearing a mask, and that's going to decrease the likelihood that any respiratory droplet particles will then get on the lid, the coffee cup, or counters or other surfaces. And hopefully they're washing their hands before dealing with the cups. But it is theoretically possible, but unlikely.
Dr. Brewer, thank you so much. Last question for Dr. Mays. Dr. Mays, this is coming in from Julie. Inmates at the Sonoma County Jail are told that the correction officers are being tested when they come in, but she doesn't see how that is possible with the lack of kits out there. Can you clarify what's happening with correctional officers as they come into the Sonoma County Jail? Dr. Mays.
Yeah, actually, we're screening them. We've advised that when employees come into congregate facilities, this is an order from last week, that they have a temperature screen and a symptom review. And that is being done. Additionally, Julie, we have done testing amongst correctional officers and other staff in the jails as a part of our surveillance testing, and everybody we tested so far in the jail has been negative.
Thank you so much. Very, very grateful, Dr. Mays. Final question going in to our Superintendent of Schools, Superintendent Harrington. This one is coming in from Sarah. What happens if my high school senior had failing grades in 2 of their classes before the shelter at home? Can he do any better with distance learning?
Depending on the school district, they each have a pass-fail distance learning grading standard. Some districts are allowing students to apply that to move their grade up. So I would suggest that they contact their district office as it applies to increasing their grade average. I do know of districts that are letting students use that to move their grade forward as a component. They can choose to take a pass-fail, or they can use it, and in this case of the students failing, they probably will choose a pass-fail, so they will get the standard pass on the report card.
Thank you so much, Superintendent. Dr. Mays, I'm so sorry. I said we had one last question for you, but we have we've had about 9 questions from salon owners coming in. I'm going to use one from Jennifer. It's very similar to everything else. She owns a salon. She has 13 people working in the salon. Not all the same folks work at the same time. They usually have one client in the chair, and sometimes they have someone who has driven them waiting in the lobby. How can she reopen her salon with respect to social distancing? Can you give her some ideas?
Well, I think, as you know, right now, under the governor's order, we are stuck, and those kinds of businesses are not recommended or ordered not to open at this point per the state order. But moving forward, I really think that trying to maintain that 6-foot distance between different stations within your facility, ensuring that you are screening everybody coming into the facility with the temperature screen and a symptom screen. And we are working on an app that might help us with that screening for employers, for their employees, ensuring that people are wearing facial coverings, ensuring that anybody who's sick doesn't come in, and ensuring good hand washing and other general hygiene practices would be some minimum standards that you can put in place that would help when the reopening occurs.
Thank you so much so I'm going to just follow up on that, and speaking for everyone who needs a haircut here in Sonoma County, Dr. Mays, do you believe sometime in the next 60 to 90 days we may see barbershops and salons back open with limited capacity?
Again, I think that's a crystal ball question. What I can speak to is what we know, that currently we have a governor's state order that is prohibiting that, and there's no end date on it. So I think we really just have to be patient and moving forward and see how this all evolves and develops. I would hate to say some particular date or time when I don't have really that answer to that specific question.
So what you're saying is, Dr. Mays, long hair may be coming in once again in our society.
Or we cut our own hair.
And I have tried that, and it does not look good. So thank you so much, Dr. Mays. We're very grateful. Hey, to all of our panelists, Dr. Brewer, Dr. Mays, Superintendent Harrington, along with Dr. Eiler from Sonoma State, we're really grateful that you would spend your Wednesday evening with us. We want to say thank you to the over 1,000 folks who have been with us since the very beginning of this telephone town hall. We are so appreciative that you would listen in tonight. Thank you for all the questions. Over 450 questions were submitted this evening. As always, if you have any concerns, any questions that you need answered, feel free to hit us up at senator.mcguire@senate.ca.gov. We will be putting a recording of this telephone town hall on our website tomorrow. We'll also share it with the County of Sonoma. If they'd like to post it as well, they're more than welcome. We'll also be putting a copy of this audio file on our Facebook page tomorrow afternoon. Again, thank you all for joining us. Next week, we'll be having our telephone town hall Wednesday at 6:30, focused on the counties of Humboldt, Trinity, and Del Norte. Until then, stay home, stay safe, and we're grateful for your hard work and sacrifice. Thank you so much. This town hall has now concluded.